About time I take a moment and explain a lot of the issues that are going on because I'm kind of tired of repeating myself when it comes to a lot of things about me and the things that I deal with as far as the hospital being a liver transplant and other issues that go on. Most of the time, I'm trying to deal with a lot of focus issues. I'm trying to deal with a lot of procrastination issues, but that's just because I have to think about so much. So I guess I'll start off by saying that uh, you're here, you've reached me. I am a liver transplant. It has happened at Frederick Hospital in 96. So I have had it a while. I've come off all of my medication except for Prograf and or tacrolimus is what I'm taking now. And I'm taking small doses. And that medication has caused me problems also. I'm not sure if the issues I've had, uh, I've had so much happen that sometimes it is often hard to figure out where to start. Most of the time, I don't even need to start anywhere. I only should highlight things, and I'm only finding that out now in life because I need help with a lot of my issues. And if most of my issues can't be handled or helped, then I know, or I'll have to learn how to deal with those things on my own. I've had to deal with a lot already. So the issue with me now, as far as all of the doctors are concerned, I really don't sit down at all like that. Right now, I'm laying down, and it's hard for me to get comfortable a lot of the time. So most of the time, hopefully, most of the time, hopefully, I can lean or stand, and that's what I'm doing most of the time. Just not comfortable to sit at all. When I sit, it's like digestion does not happen. I cannot hold using the restroom. I get angry. I don't get volatile because that's what they actually put in some of my paperwork at the hospital. And there are a lot of issues that I deal with, and I dealt with a lot of my anger very differently than they would say. I do get very passionate, and I do get very not loud but very restless because I move around, and sometimes when I talk, I do talk with my hands, and I try not to because it makes people feel uncomfortable in that type of environment. And I've learned that over the years growing up, dealing with all of this stuff in the hospital, I've had therapists in the hospital, and I've seen two or three psychologists, one of whom has quit, one is still there, and I was told by this particular individual that I was lucky there was another individual that would see me, because if it was up to them, then I would get no help. And I've not wronged that individual, but we've had disagreements, and that's what it's mostly came out to be, just a disagreement between me and that individual. A lot of the time we've not gotten to talk about things because I was questioned, and I felt that there were a lot of issues that we didn't get to talk about because of prescribing medication. I was geared towards medication almost all of the time. And that was only one of maybe two issues that I had with that individual. And I chose to talk those issues out with that individual, but that's getting off topic. That's that one psychologist, and like I said, I seen the other psychologist. That individual is no longer working there, and I've seen another psychologist outside of that institution. That psychologist actually had been talking to a counselor that I was talking to because I needed somebody to talk to, and he helped me a whole lot. I have that individual's name and other individuals' names. I choose not to say them now because that probably will make things look very, very kind of, like I'm reaching for a lot of things and I'm not. I'm looking for understanding as far as the reason why I made this video. I'm looking for some information that would better help me deal with this issue properly because I'm not sure at the moment as to how to deal with that. That is one of the issues. So, I am 33 and I am about to be 34. The issue that came up just recently with the new doctor that I'm seeing, that's a transplant doctor at this institution, and his new team, on my asking to see a new team after having no resolution with the old team, stemming from one issue, which is the same issue that has me thinking about a lot of things to this day and moving forward. It's making a lot of decisions harder and a lot of things more hesitant upon when it comes to me just initially doing, for my betterment all the time. There are some issues that have happened that make it very hard to listen to the counsel of the doctors because they have come in with misdiagnosis sometime, and two of those diagnoses, had I not questioned and asked properly and thoroughly, I would have had a virus pumped into my system on one incident, and another incident I almost had the wrong uh, reaction to some medication that I was not sure of. I did ask about it, but it was new and it was just something else I'll have to talk about because I have all this paperwork and so much other stuff going on. But just to stay on topic, that was that issue. And the other issue is um, the other issue, detailing that one and the reason why a lot of issues have been happening with the liver transplant to this day is because of a little piece of liver. Is You have two lobes of liver. I have one lobe, and I'm not gonna say left or right now because I'm not sure. I don't want to get it mixed up. But I have one lobe of liver, full lobe piece. Well, actually, it's a full functioning piece of a liver that I received in 96, and that piece of liver had had another piece of the other lobe attached to it, but that piece of the other lobe of liver is like only bile ducts and uh, valves and other things like that. So it's not really a big issue, I was told back then. And early on, I was informed that this issue, if it did become an issue later on in life, would just need to be removed. And that is what I was told early on. And it wasn't said like it would be a really big issue at all anyway. And I never thought twice about it. So I went on living my life, eating better, changing my diet, doing a lot of other things that I was wish I had counsel on as far as changing nutrition and trying to understand my body and how to work better with some medication, and the moments that I have gone without medication due to being homeless for a good period of my life and not having an address, and random moments between going to get medication, forgetting medication places, and going back to get it, having to go um, backtrack because I forgot my phone, or I forgot another important item that I needed in my day for school if I was at school at the time, or if I was working on an important project, if I was doing personal development reading, trying to find books and other materials that I was using, DVDs and videos, audios also. Just a lot of material, just trying to keep up with things and still being homeless, and trying to keep my diet and keep up with the hospital and keep up with everything that they would ask me to do outside of job. And that's another issue as far as health is concerned. Having a job and dealing with health issues is probably the hardest thing that I've had to try to figure out, and it still hasn't really, become easy or an answer question because of the in and out issues that I have with the hospital and my health at times. And the hospital does not speak up for me on issues as far as how much time I spend in there and how many issues I've had to deal with in the past, which make it hard for me to have a very clean working schedule. But I've had jobs that I've held down for years, and one of those jobs was being a state fair employee. So that actually helped because the schedule only lasted for 2 weeks, but that 2 weeks helped me stay on insurance as far as the state was concerned to receive food share. And once you received food share, you had health insurance benefits. So, being a liver transplant, a lot of things had to be covered with insurance. So, that made a whole lot of difference as far as how I had to deal with my health and how I had to deal with my job, because it's very weird that when I went to a doctor's appointment that was at a primary care doctor that I had found that finally took my insurance here in Wisconsin, I uh, I built a good rapport with this doctor, and she began to know me well, and she knows that I was not going to tell her any untruths as far as anything was concerned when it came to my health. And she agreed, she agreed to at least be honest with me as far as the things that she could and couldn't help me with, and other issues that she needed to have referrals for because of the way that things are set up with me and my health. Some issues that go on, the referral has to be sent from the liver doctors at the Frederick Hospital and to this doctor, so that this doctor can have the okay to know what's going on, because they don't have the access that they would need for assisting me at their location, because I have a very extensive record. And that is another issue that I have had problems with receiving my record. I've written a few times, signed a few documents. I've signed confidential documents from Social Security and the hospital to have my records sent from the hospital to the Social Security office. That hasn't happened. The few documents that the Social Security office did receive for some of my applications, I have filled out more than four applications. The information that was received, I had to take it in by hand to the office downtown and have it scanned into my records physically, because that was the only way that I could get most of my documentation in, and to prove that I actually do have some type of health issue at all, because the records that the Social Security office had when I had a hearing in front of a judge was no more than maybe a few appointments, and spread years apart from 2007 till I think it was in, maybe I'm not sure, but 2015. But it was a very big gap, and there were other gaps in the history that I could not prove, because the records that I held in my hands were inadmissible in court. So that would not help me in my case proving anything. I was not informed of some of this beforehand. I was only informed of having my records would help. I was not fully informed of the issue of having my records in hand, walking in the courtroom with them. And at that moment, when I had walked in the room, I had a biliary stent in at this particular time, so I could barely stand up, even to a I could barely stand more. I could barely straighten up, and if I was in a sitting position, it would take me time to stand up. It would take me time to move. It took me time to walk as far as having the biliary stent in, because I was so cautious that anything that I did would pull the stent out. And the stent was sold to me inside and outside. Uh, uh, Somebody told me that it was a uh, I want to say pig stitch, but I'm not sure if I asked or how I found that out. But that was how the tube was sold, how it was sold to me, inside and out. I I was supposed to flush it every um I was supposed to flush it like during meals, or before or after, or if I could just space it out to three times a day: once in the morning, once in the afternoon, and once at night. And I'm only going into detail of the tube issue because the tube issue lasted longer than it was supposed to. I was only told that this tube would be there for drainage when I went into the hospital one day, because I had the worst pain I've probably ever had at that point in my life. After that, I felt worse because of that issue getting worse. But as it stands, that issue right now no longer is a big issue. But the biliary stent was placed for drainage only initially, for a day, maybe two. Then 3 days passed by and no doctors came to see me, and they checked on the tube and they were just like, all right, drainage looks good. The fourth day they came in and they prolonged it another 2 3 days, and at this time they were trying to send me home with it and make talk me uh, you know, talk to me about how other individuals lived with biliary stents outside the hospital, and just tried to really inform me of how life could go outside the hospital with the biliary stent in place. And I did not feel comfortable at all because of how sensitive I was when it came to the stent. So I kind of asked him for maybe another day or two, just to see what was going on and deal with the tube. But I would really enjoy if the tube would not be there longer than 2 weeks, like, was kind of said after the fourth day. And I'm only saying all of this now because it took probably a few days of them coming back and forth having the same conversation, and I felt as if I was made to be feel. I was made to, um, or I felt like somebody wanted me to feel comfortable leaving with the two, but the issue was not resolved as far as they were concerned, as far as pulling the tube out and going on their way, because I was told at that point in time, if the tube was taken out, that it would be very hard to replace it if anything was to happen. And that issue almost caused me a rejection because of how much pain I was in. So I apologize, but the issue of the stint lasted longer than a year, and that led to a lot of muscle deterioration because of how active I used to be before I had the stent placed. And there were a lot of things that changed when I had the stent placed over time. So, as far as the biliary stent goes, the issue lasted for longer than a year and I believe 4 months because it was removed unexpectedly and without reason 2 weeks before my birthday. And I kind of seen the doctor beforehand, and he kind of just had a few words with me, and he was just like, well, we'll try to get it out before your birthday as like a joke. And we all kind of laughed, and I was like, hey, yeah, that would be something that would be enjoyed. And it was just a good thought because at that time I felt very misled by a lot of things that had happened up until that point. That's why I mentioned the biliary stent, because at the end of that issue, a lot of things changed with me as far as how I trusted and how I listened to what was said to me, because a lot of things were said and I was questioned a few times about what I was doing when I was told directly from the liver team what to do. So that is the only reason why I kind of really mention that issue, because it's a big issue in itself. Um, the issue now with that particular lobe of liver is that I guess it needs to come out. And I was told a long time ago, probably about 10 years ago, and I was 23 when I was probably going through this issue the first time, and that was around when uh, something else had happened too. But the biliary stent was the big reason that made a lot of things happen with this little piece of lobe of liver, because the piece of liver that I had initially in the 96 in the June, or yeah, the June 96 transplant, that lobe of liver is doing 120% better as far as everything is concerned, size too. So that kind of adds to another issue that I was informed of from the liver team, that the the liver itself was bigger and took up more space than expected. So trying to open you back up and then reclose you would pose another issue because the liver itself is the size it is. And it wasn't really talked about as being a big problem early on. But now there are a lot of issues that seem to be a big problem now, but they are not talked about anymore at all. The issues now that are talked about are very surface issues. Anything surface, anything topical can be talked about or dealt with. I changed the liver team, and now we've run into the same issue. And this is just me being able to get a lot of things changed now. And I was not able to do a lot of other issues that I was not able to take other avenues that I was advised of at certain points in times due to other issues, and I'm not going to go into a lot of those right now. But it's a big story, and I'm only just trying to get the top of it out right now because this is what a lot of people ask me. Yeah, I don't sit down. Um, just a very finicky diet. A lot of things that I do eat have to be non dairy, uh, non pork. I'll throw up. It's like I'm allergic to pork now. My body feels like it's very allergic to anything cooked in pork, around pork. The smell of pork actually makes me nauseous now. I'll actually wake up out of my sleep when people have cooked it in the past and just I'll just have to leave. I have my own place now due to a lot of long hard work, but that's a whole nother issue in itself. And now that I have a better hold on some type of diet, I can kind of enjoy other cooking avenues because I've learned to cook different items that I didn't grow up with, items from other countries, and I've learned to find options as far as nutrition in life because a lot of processed things do not benefit my diet and they do not help me because of the way my body feels, and most of the time I do not digest them well, if at all, because of the ingredients in them. There are a lot of items that have pork in them and other dairy items, so I just kind of stay away from all of that. Um, so with the problems as far as health, I've just been trying to maintain and have a good immune system because that does help. I try to make sure that I enjoy a good fruit supply. I try to walk every day now. I am enjoying workout center, so I have to uh, keep some type of cardio together because it gets hard if I don't work out or do something as far as walking because laying down feels comfortable. Like I said, I very rarely sit, and if I do, I'm leaning all the way back. Even when using the restroom, I have to get extra super comfortable, so that's kind of very uncomfortable if I'm in a public place. So that rarely happens, if at all, most of the time. So going out is like not really one of those things that I really enjoy doing, but over the time I've been able to plan better and become more efficient with moving around outside as far as dealing with hunger and using the restroom and having a better attitude as far as dealing with the pain issue that I have because I'm always in stomach discomfort and it's hard to prescribe me any pain meds because of the liver transplant, and I had cancer, lymphoma in my right kidney in 2015 that was there for probably about 3 years prior to it being removed, and I didn't know. So that was a whole nother issue as far as like why I have a trust issue. And there are other issues as far as dealing with just being able to have an open conversation about how medication makes me feel, and how how I deal with trying to refocus a lot of my energy into dealing with myself better, because that's only that's really the only thing that helped over time, because having to deal with so many issues and not getting the help needed, and over time finding out that the help was there, I didn't know to ask for it. Other individuals did not give me the option at times when I kind of did learn or just start asking for options, just start asking for other things that could possibly happen as far as outcomes dealing with almost any issue that would come to hand, because I am a very option person. I will enjoy options, and I am enjoying a lot of things because of the understanding I have when it comes to finding options and variety. So, with all of that being said, that is the introduction to the issues that I deal with as far as health. And signing off, yes, most of the time, uh, dealing with all of this is hard, and it's very stressing on the brain. So, a lot of time is spent in meditation and calming and keeping self calm, because man, it's not hard no more. Like, I really do have good control over keeping myself calm, because I've been told some very harsh things by doctors, and it's very hard to deal with healing when you're angry. So I will say, in parting, enjoy everything that you can, be perpetually prosperous always, people, and love.